All right. Hello, Facebook family. It's Kirsten Hagland here. Welcome to another episode of Weekly Hope. I'm so glad that you're joining us. This is our last episode before the end of the year, before the holiday season is over. And so we are really excited today to again talk about how we handle the holidays in recovery. It's going to be a really, really great session. So if you're here joining us again and you're a frequent viewer, welcome back. So glad to have you. And if this is your first time here, welcome. What we do here at Weekly Hope is invite experts, clinicians, therapists, advocates, people with their own recovery stories, just people from across the spectrum of eating disorders and mental health to share their wisdom and insight about various topics. Every week something a little bit different, and we like to get not only their thoughts but also hear yours. So throughout the show, please feel free to comment, let us know your name, where you're signing in from, and of course if you've got anything on your heart that you want to share throughout this process, feel free to do that, as well as ask questions. One of the things we love about the fact that we get these experts and these like truly world-class people on here to talk is that we, you have the chance to ask them your questions directly. So, and I'll just keep reminding you of that throughout the show. So, all right. Well, without any further ado, I am going to introduce our guest and bring her on screen. There we have Dr. Gaudiani. Hello, lady.
I'm so psyched to be here. Happy holidays to everybody.
Yes, thank you so much. And of course, Dr. G has been on the show before. We had an amazing time with Dr. Gaudiani back in the summer talking about health at every size. And that was an exceptional conversation. And if you missed it and you want to watch it, you can head over to our YouTube channel, the Eating Disorder Hope YouTube channel, and check it out there because it was a fabulous conversation. And it's actually kind of something that we talked about in that Facebook Live that I want to start out by talking about today. And that is that when we first spoke with you, you were in the process of finishing up and getting ready to launch your baby, which was your incredible book, Sick Enough, which actually we just talked about last week on the program, and I put a link in the comments because Dr. Dina Cabrera was on and she talked about the book. So I am going to put the title right here, and I want you to tell us all about the book and how it's going so far.
Thank you. I would love to talk about it. So the book is Sick Enough, A Guide to the Medical Complications of Eating Disorders. And it is on Amazon as well as on the Routledge website. It is, it's just so exciting. It's the first book written about what happens to your body as a result of disordered eating or eating disorders. And I wrote it for patients so that they could be validated in the diversity of their experience with eating disorders. I wrote it for families and loved ones of patients so that they could really understand how hard eating disorders don't who don't know about eating disorders. This is really a great introduction to them. And so patients can actually bring books to their primary care provider who said before, like, I don't know much about these. I wish I knew more. Now patients can be like, here.
Yeah, which is so incredibly helpful because, as they're learning about their issue and their struggle, and they're getting so empowered. Okay, I know this, and yet they might be seeing someone on their treatment team, or unfortunately maybe someone in the medical profession who doesn't have any clue or as much psychoeducation as they've had. So here, rather than trying to spit out all that information in one treatment session, they can just give them your book.
Yeah, that's my hope. That's really my hope. And one of the goals that I had when I founded my clinic 2 and a bit years ago was to really uplift the quality of medical care for people of all ages, genders, and sizes who have eating disorders across the country and across the world. And because, although I've I still have space in my clinic and we see patients all the time, I won't be able to one-on-one see everyone who might benefit. And I really hope the book helps them.
Right, absolutely. And I love I love the name Sick Enough, because it's a thought that I know pervaded my thinking, as well as so many other, people that I've heard from in their struggles as well. In that, oh, I'm not sick enough to get care. I'm not thin enough. I'm not sick enough. And so I love that you validate that experience too, and help shed light on it. It's something we'll talk about when it comes to how to deal with people around the holidays who think you don't look sick enough to have an eating disorder. And it's so tough. What is the feedback and the response that you've gotten so far, Ben? I'm sure it's just been super positive.
It's been really lovely. I have been incredibly grateful that eating disorder professionals whom I love and respect have written wonderful testimonials for it within the book. And then, just getting letters or emails from people who have read it and who say, like, this really changed my last month. I read this and this changed how I thought about my body. I never knew that I could have a serious eating disorder and be a so-called normal weight or higher weight. I never knew. Or I never knew that the things that I was experiencing were actually from my eating disorder, and that there could be something to be done about it. Just really, I got a lovely letter from a clinician who works in a treatment facility, and she had just gotten the book, and she admitted a patient who was in her mid-30s who had been in and out of treatment a number of times and was really struggling that first week. And the woman said, I just don't feel I'm sick enough to be here. And the clinician was like, wait, I've got it. You need it more than I do. And they actually read it together during the weeks of her stay. And she was able to complete meal plan, and cognitively, as her brain woke up, it was easier to read it. And that is the coolest.
Wow, that is a really, really neat experience. And we've got Miranda here who just wrote, I have read the book and found it so validating and helpful. Thank you. So
Miranda, that's amazing. Brava, and keep pushing.
Yeah, thank you, Miranda, for letting us know. And I see we've gotten a bunch of new people on, so just want to say hello and welcome. We've got Dr. Gaudiani here talking about her book, Sick Enough. And we're also going to be diving into holidays and recovery. So please, if you just joined recently, say hello, let us know you're here, where you're signing in from. Denise says, hi, and really hoping I can get it in the new year. Yes, awesome. This is a wonderful, wonderful resource. So we hope you can too. But yeah, and feel free to ask your questions at any time. That's what we're here for. So another thing I just want to say about the book, and what I think is really cool, is that it gives, thank you as a doctor for writing something that validates all the craziness of the inner voice of the eating disorder. Because I know it can be so, and we have in the conversations that we have with people here, even on this show, there can be so much craziness going on up inside your brain. And sometimes it's you just want to read a hard copy. You just want to read it on a page. A doctor like you saying, no, what you're feeling is normal, or is normal in the process of an eating disorder, and you're validated.
Yes. Yeah, absolutely. And people have so many different medical problems that happen in their body. Every person is unique. And to be able to say, it's never okay with your body when you don't eat enough and take care of yourself. Your body is going to have some way that it shows it. It might not be in your blood tests. It might not be in your vital signs. It certainly might not be on the scale, and very few people actually ever need to get on the scale. But there are going to be ways in which we see the body shows you, I'm not happy, I need something different, I need nourishment and kindness and rest. So it's actually really vulnerable to put out there what I've been doing for the past 10 years and just be like, oh gosh, I hope this is helpful, but it's been a joyful process.
Yeah, well, we're so glad that it's out there and that you are in this field and doing this work. So thank you. And I said the word baby because it is I know I have several friends who've written and published books in the last couple of years, and I know it's like birthing a child. So go you.
Thank you. So right.
Yeah, so transitioning actually into how, it is the 19th of December. So we've got, for people who celebrate Christmas, that's right around the corner. Obviously, New Year's as well. And the hustle bustle of the season is we're in the thick of it right now. And the next week is potentially going to be super joyful and also extremely, incredibly stressful for people in recovery from an eating disorder. So want to dive into that with you. And let's just kind of start off with the comments from other people, because I loved your facial expression when I said, obviously you see a lot of people around the holiday times, maybe friends you haven't seen before or family members who have no idea what eating disorders are all about and are not used to coming into contact with someone who's ever had or experienced someone. So you hear, what in the world and how in the world do we handle people who are toxic with grace?
Oh, it's so hard. I think the first thing to say is, there's so many things to say.
Yeah.
Try to come into each of the hard situations well armed. And by well armed, I mean nourish yourself well. If you're on a meal plan, be on meal plan. If you're beyond the meal plan stage, really deeply engage in good intuitive eating practices and get enough sleep and do the actual work of self-care. Self-care I like to think of as not a privilege or a sort of a floofy thing, but as a piece of discipline. You have to be disciplined to engage in regular self-care. And so I encourage everyone to sort of approach more complicated social situations as well prepared as they can be, because then they're more likely to have access to their inner wisdom, to their boundaries, and to distress tolerance when things go badly, which they can at the holidays. And then I think when you're in the presence of someone who's toxic, it's really important to recognize that you don't have to sit there and take it. Now, that's complicated when it's your grandmother, and there are certain sort of respect dynamics that have to take place, or if you're trapped at the same dining room table with family members for quite some time, or in the same apartment with someone for a long time. But it is okay to excuse yourself from conversations, and it is okay to tell your eating disorder, we don't believe that. Those aren't our values. So if somebody is, making the old, oh, you look so great, or you look like you've lost weight, you look like you've gained weight, if they're making weight comments and the power dynamic feels safe, you can say, actually, I prefer not to talk about weight. Thank you so much. It's nice to see you too. How have you been this season? And sort of set the boundary and turn it. Mm-hmm. I encourage patients not to engage in old discussions also, where if they've always had to listen to diet talk from their Aunt Martha, you don't have to anymore. Even if that's the only thing you and Aunt Martha know how to talk about, you don't have to do that anymore. You can say, Aunt Martha, let's talk about your gardening. Let's talk about anything else than this thing that we've bonded over before. If the table starts to get toxic, a beautiful dinner is set, there's a moment of gratitude for the food, and everyone starts talking about how, oh, I can't eat this and I can't eat that, and now I'm gluten-free and I'm dairy-free, and oh, I'm going to gain so much weight from this. If the power dynamics feel safe, people can say, I would rather not talk about weight when we're sitting at this beautiful table and eating this delicious food. If you can't resist, I'm just not going to participate. I would certainly love to talk about something else. Let's talk about how yummy this is, or let's talk about almost anything else than weight or weight loss. These are ways, and I respect, like, power dynamics may not always make this possible, in which case, get out of there as fast as you can. Like, have your respects, feel the grief that your family or friends or whoever it is sort of can't rise to the occasion and avoid some of these topics, and get out of there and surround yourself by people who do share those values and who are safe with you, because you're allowed to do that.
Yeah. Yeah, it's so validating too to hear also that you have the ability to set a boundary and to excuse yourself from a situation, if need be. And I think that can be really, really hard too for people pleasers, because we don't want to upset anything. We don't want to upset other people. It's hard to say no. It can be very, very difficult, but it's like you have to put your recovery first.
Yes.
During the house. It's always, right? But I think we have to go into it with an expectation that's going to be more challenging. So we can't just do normal. It's like we have to do extra reinforcement, right?
Yeah, that's absolutely right. We have to do extra because this is a tender time.
Yeah.
This is a tender time and it's a tough time. These are the days that are the shortest. We have a lot of darkness environmentally, and that can be tough on our soul. And all in all, this can be a joyful time and it can be a nostalgic time, nostalgic positive, nostalgic negative. I think allowing ourselves to meet our needs is so important. So many of my patients struggle with giving themselves permission to have needs and then consistently meet them. Whatever those needs are, so many of my patients struggle with the sense that they're too much and that they have too many needs for reassurance, for recharge, for comfort, to soothe their anxiety. And what I constantly tell them, and it helps me too, because never having had an eating disorder, I have so many similar temperamental traits as many of my patients. It just is so good to remember I have needs. They are uniquely mine. I have no judgment of my needs. Even if others do, they don't matter. And I'm going to meet those needs, because giving myself permission and, in fact, disciplining myself to meet my own needs is going to be most likely to allow me to really get to a good start in 2019 and begin the year in a space where I resolve to honor my values.
Yeah, I love it. I could listen to you every day. And I want to talk a little bit and get your insight and wisdom on this as a doctor, right? As a physician. And that is that, okay, so what do you do? Because we know that in order to meet those emotional needs, you talked about it before, preparing to go into toxic situations, you have to prepare first, right? You have to make sure you're getting sleep, engaging in intuitive eating, following your meal plan if you're on a meal plan, all those things that are just very physical. So let's say, because the temptation to engage in eating disorder behaviors is very, very strong when you're constantly surrounded by food, which we all are during this season. So in particular, for those who struggle with bulimia or binge eating disorder, or where binge eating is a part of the eating disorder behavior, how does someone physically recover from a relapse or a binge episode or something like that? Because there is all kinds of really horrible advice on the internet about how to do that. And it is a realistic situation for people who relapse or are in the recovery process. How does someone handle a relapse situation like that physically? How do they do that self-care so that they can pick themselves back up and continue on in their recovery?
Yeah, I think I have two thoughts about that. The first is, what sets most people up for a binge is restrictive eating or not caring for yourself emotionally, or not being safe to take care of yourself emotionally. So if you wake up in the morning of Christmas Day or of a Christmas party or of a New Year's party, and you say, well, there's going to be a lot of food at this party, so I'm going to eat less during the day, which unfortunately is very common magazine advice. That is going to set you up for binging. Because the fact is, not only is the human brain wired to seek food like crazy when it doesn't have enough food, but for someone with an eating disorder, that brain has been trained over the years to be hyper alert to inadequate food intake. And so the second, even before you start to restrict, just thinking about restricting can put the brain on high alert and be like, wait, I think we might go into famine again. We have to eat right now. We've got to eat a lot of it to get safe. So resolve that you're going to eat normally throughout that day, including if it's a hungrier day, you're going to eat more, even if you're going to have a delicious feast in the evening, because human bodies manage that fine. There is this popular misconception meant to keep originally women and now people of all genders controlled, small, and insecure, that says unless we wrangle every bit of what we eat, our bodies will be chaotic, impure, and out of control. This is total bullshit. Yes. The reality is that our body can manage the feast days, and it can manage in very small moderation the days that you might be busier and didn't quite get enough in. No excuse to restrict. The point is that the body is amazingly forgiving. So no restriction in order to reduce the chance of binging. And then the second thing is, when binging happens, or binging and purging, be gentle. So many of my patients get so mean with themselves after they engage in an eating disorder behavior. Be gentle. Show compassion and grace to that part of your soul that couldn't resist. And just say, oh, honey, yeah, I get it. Of course you couldn't, because this was going on. There's no undoing to do. My body can manage that. The next meal is a new opportunity. The next day is a new opportunity. Let's be gentle, because the meaner people get, the more they are likely to continue to engage in behaviors as a sort of a punishing philosophy. Yeah. Be gentle, be kind, reset, take a break, take a time out, walk away, do those self-care things that you need to do. Journal, put your feet up, have a cup of tea, read a book, put on Netflix. Whatever you need to do, engage in that thing.
Yeah, that's so good. Thank you so much for that. And yeah, it's very, very easy when that happens. Or if, too, I know the game, if someone has struggled with restriction and adequate calories, it can be so frustrating to try to figure out how to do your meal plan within all of the parties and all of the meals and all of the everything. And that's what, I'd like to ask you too, and get your validation too with this, is that also you can, if everyone is going to be not eating, like let's say you're at home with your family all day and everyone is not good, no one's eating anything all day until the big meal. Like you can say, no, I'm not going to do everything the way my family is doing it. I'm going to do what I need to do for my recovery first, right?
Yes, absolutely. That's completely correct. And that can be tough, like you said, for the pleasers, for the ones whose, father is going to say, oh, watch it. You don't want to eat too much now, or you're going to get blank as you eat dinner tonight. Yeah. If you possibly can in that moment, spare a drop of compassion for whatever environment it was that your family member grew up in that makes them believe those toxic things. Because that means that they were exposed to the same toxicities and they just didn't know how not to replay them. That doesn't mean that you adopt those as your values, and it doesn't give your eating disorder the excuse it needs to be like, see, your father said it. Your therapist, your dietitian, your doctor are probably wrong. I think your father's right on this one.
Yep. Yeah. Nope. I love that. I just want to point out, Sarah here says, I really needed to hear that. And that comment popped up when we were talking about self-care and being gentle to yourself. And I just think that's so cool. So thank you, Sarah. And Sarah joins us. And so we're just so glad to have you back. Thanks, girl. And Miranda also said, taking mental notes here for the social situations I have coming up. I've had to let go of friends recently because I realized they were fully based on weight and diet talk. And I would say, yeah, that's amazing.
Yep. And that's a painful part of recovery. Recovery in so many ways is not this sort of joyful kumbaya experience. It is hard. It is a slog. As Brene Brown says, it is a street fight. And one of those is removing yourself from relationships that aren't congruent with your recovery values and that keep pulling you back, either directly through diet talk or indirectly through gaslighting or meanness or gossipiness, whatever it is. I just want to give all of those beautiful souls out there the message: you have a right to establish non-toxic, loving, balanced relationships.
Yeah.
Find those. demand that of others, and offer it yourself.
And they do exist. Like, there is hope that they do exist. Real relationships like that do exist. Carrie says, thanks for the reminder, my people pleasing can get out of control. Yeah, all of us run into that wall. That's for sure. So there's two more things that I want to talk with you about before we sign off here. So one of them is, I'm trying to decide which one to do first. First, let's talk about New Year's talk. New diets. And I think that the diet world has gotten a little bit smarter. They've evolved as the health and wellness environment has evolved, and as the eating disorder community has gotten more vocal about their tactics. So they've kind of hid maybe the diet or the weight loss verbiage from their campaigns, but it's still the same marketing trick. It's the same ploy. What can you say to people out there who are tempted or seduced by the idea of January 1st hits and I'm going to try to lose those 10 pounds I always wanted to lose? Why is that setting yourself up for disaster?
Oh, for so many ways. It's a great question. You're absolutely right. The dieting industry, which is a gazillion-dollar industry, has taken the word health and it has turned the word health into almost a dirty word from my perspective, because now health, sort of like people who say, you look great, and we know exactly what that means. Health has come to mean that somebody is either sort of naturally, genetically, or perhaps through really sick ways, more closely approximated a narrowly defined vision of white, young, thin, cis, hetero, able, and that's what people envision now in the United States when they say healthy. There's nothing medically healthy one way or another about those set of traits. That just describes a privileged subset of people who do get more things in our society and are treated better. But that has nothing to do with medical wellness, nor does it necessarily have anything to do with emotional wellness. So, and yet it's so easy for the eating disorder to be like, oh yeah, we're not focused on weight now, we're focused on health. Well, hello, orthorexia, because like there's a million ways in which people want to sell you ways of getting healthy. The real answer, as we discussed in my last session with you, is that the best care of your body is going to emerge from intuitive eating of delicious, yummy, nourishing, satisfying, energizing food consumed throughout the day, and joyful movement within one's ability and interest, and attention to one's mental health care. That is basically like, if everyone could resolve in the new year to focus on that, health would really actually improve, rather than a healthist society, which is diet culture wrapped up in a bow, causing people to engage in restrictive behaviors and weight-focused behaviors that can often make people sicker, either physically or emotionally.
Yeah, absolutely. Thank you. So good. Sarah says hello from Seattle. Hey, Sarah, it's great to have you back. Thanks for joining us. Wendy asks a really great question. She says, what's the best way to determine your recovery values? That was, I think, in regard to your talking about removing toxic friends who don't necessarily share your recovery values.
Yeah, that's probably a great question to discuss with your therapist. But what I would say is, ask yourself what matters to you. Ask yourself what you truly care about and what the people who love you most would describe you as, and try to hark close to that. That's what we're aiming for. And everyone's are going to be really different. That's why I like opening all of my sessions with my patients by inviting them to share with me what are their goals and values, so that I can be less assumptive as a physician in a place of power and not impose my values upon them mindlessly as I have done before and as my profession tends to do.
Yeah, that's such great advice. And Wendy, yeah, I would just second what Dr. G said about making sure you talk with that about your to your therapist if you have one. If that's something that you're processing through, obviously that's what that's what people like Dr. G are for in a good therapy session. And obviously that can be a process. I want to ask you one last question. You've been so generous with your time, but one last thing I would love to get your wisdom on is how to support someone during the holidays if they are in recovery, especially maybe let's say they just recently got out of treatment or are still in outpatient care. How can someone best support a loved one?
I recently heard a quote that being an ally isn't enough. Be a co-conspirator. So fun and a little bit sneaky and a little bit rebellious. So let's say that you have a sibling who has an eating disorder and you know about it and you know it's going to be a hard time for them. And this is what people can suggest to their siblings if they are themselves involved. You can say, all right, I need you to be my wingman here. If conversation starts turning crazy, step in, take some fire for me, because I'm not in a place where I'm strong enough to take the fire and I've taken too much of this family's fire already. Just be like, whoa, hey, we're not going to talk about that. That's a silly topic. Instead, football, and to really sort of actively engage, or just to bear witness across the table and be like, and then later just give that person such a hug and a kiss. I'm Italian, so I'm physical. Not everybody has to be physical in their affection. And just be like, I love you so much. You're being so brave. You're really kicking the shit out of this. If you need to leave early, I'll cover for you. Or I see you getting that glazed look on your face. Do you want to go take a quick walk around the block? Can I help you clear your head? So I would just say to family members and loved ones, be a co-conspirator and be gentle and encourage the rest of the family to the extent that this power dynamic is possible to just be like, hey, Mom, when Sis comes over tonight, let's try not to make diet comments, okay? I'm looking at you, Mama. Don't do it. It's going to happen anyway. But to try to set the stage a little bit, having that co-conspirator can be really helpful.
I love that. Such wise advice. Thank you so much. Dr. G, you are a rock star. Thank you for sharing your time with us and for being so open about this. And I just want to remind people again to check out Dr. G's book, Sick Enough. Buy it for yourself, buy it for a friend or a loved one. Or of course, if you are going through the treatment process or seeking out medical help, professional help, this is an incredible resource for that and potentially for members of your treatment team as well. So Dr. G, we hope you have a happy holiday season.
Thank you. You as well. And to everybody listening, happy holidays.
Yeah, thank you so much. All right, we'll say goodbye to Dr. G. Bye. And I'll just say goodbye to all of you. Thank you so much for joining us. We're going to have this video pinned to the top of our Facebook page throughout the holiday season. So if you heard something here that would really be encouraging for a family member, a friend, or you just need to hear it again, you can always come back here to our Facebook page or, of course, onto our YouTube channel and check it out again. The link to Dr. Gaudiani's book is in the comment section. Again, that's Sick Enough. We were just there were so many wonderful things that she said, but some things that really stuck out to me that I'll repeat again: laying a good foundation, preparing the groundwork, intuitive eating, taking care of yourself, self-care, all that is so important to go into the holiday season to be able to have the emotional strength to handle it. Be gentle with yourself. If a relapse is a part of the next week and a half or so, things happen. Be gentle with yourself. And the last thing, of course, what we just talked about, enlist those co-conspirators. Most likely you have family and friends and people there around you that love you, that want to see you succeed, that aren't afraid of your needs. They want to be there with you. So just ask for those co-conspirators. And if you are one, be one. All right, so happy holidays to all of you. And the next time you see me, it'll be 2019. So have a beautiful rest of your year, and we will see you soon. All right.